So my name's Grant, nice to meet you, Peter. I'm going to be a physiotherapist today. So I understand you've got a tear in your calf. How's that feeling today?
It's quite tight and uncomfortable, yeah.
Okay, so what we're going to do today is do an ice treatment, and that's going to assist in the healing process. So what I'm going to do now is just go get some ice. I'll be 2-3 minutes. If you've got any requests or you're uncomfortable, just let my assistant know at the front desk, but I'll be back just in a moment.
Okay,
See you soon, Peter.
Thanks.
So Peter's just got a gastroc pneumonia tear. So what we're going to do for that is a cold treatment. The hope for doing that treatment is firstly it's going to reduce the bleeding via constriction and viscosity. Secondly, we're going to be limiting the edema and the pain nerve irritants. And we're going to be decreasing the metabolic rate and hence the secondary cell necrosis. And lastly, we're going to decrease joint effusion and edema, and ultimately that's going to improve the healing process. Jimbo? Jimbo?
Oh! You scared me, man. What are you after?
Can I have some ice, please? Thank you.
Have a nice day.
Now look at the ice. Let's chat about a few contraindications and precautions. So 2 contraindications to cold treatment are firstly if there's circulatory insufficiency, secondly if there are any conditions that will be exacerbated by the treatment. In terms of precautions, firstly, if there's no ability to communicate, so my patient can't speak to me, and secondly if there's a sensory loss and the patient can't distinguish between hot and cold. In terms of danger, the only real danger for this treatment is an ice burn. And that only really resolves when we use a big block of ice on the skin or on the treatment area. So that's why we're going to use crushed ice to do so. Let's get going with the treatment now. And just before I go into treat Peter, I just thought I'd share some of the factors that affect dosage. So it depends on the tissue that you're treating. So if it's superficial, then we're going to treat for about 5 to 8 minutes. Whereas if it's really deep, we'll go from 10 to 20 minutes. So for Peter, I'm going to do 10 minutes. It's not too deep, not too superficial. That's treatment time I'm going to go with. Before starting treatment, it's important that you inform the patient what the treatment is, what it does, and to get informed consent about what you're going to do. So that's what I'm going to do now. Make sure that Peter knows what's going on, and that he can consent to it. Peter, hey Grant, how you going? So the treatment today, the cold treatment, we're doing it because a few reasons. Firstly, it's going to reduce the blood flow. So since your injury to your calf, you've got a lot of blood flow going on. So imagine tapping a lot of water flowing out. You're going to reduce that, slow that down. So that's what the ice is going to do to your blood flow. Secondly, we're going to enhance the survival rate of any existing cells that have been damaged at the site. And lastly, we're going to activate some cold receptors by the treatment, which is going to give you some pain relief. So they're the 3 main reasons that we're doing the treatment today, and hopefully it will assist you in the healing process. So when having an ice treatment, Peter, you should feel a gradually increasing cold, which may then be followed by a period of discomfort, and the area then should go numb. So if you experience any extreme pain or discomfort, you'll let me know immediately, unless you may be in danger of an ice burn. Now it's important that you may remain still throughout the treatment, and if you feel uncomfortable at all, just call me. So do you understand what I said to you about the treatment? Any further questions at all?
No.
So are we right to proceed with the treatment now? Awesome, we'll get started. We're preparing Peter's ice treatment here, and what we'll need is a bag of crushed ice. We're going to place that inside a damp towel and fold that up. We're going to apply that to the calf of Peter, and then secondly we need a cube of ice, an ice cube. What we're going to do for that is an ice massage test to see if Peter's allergic to the ice at all, and we'll see that through redness or inflammation of the skin. And the last thing we'll need is 2 test tubes, one filled with warm water and one with cold water for a sensation test to make sure he doesn't have any sensory loss. So we're going to do the test. So what I want you to do now is just to get in a position for me to lie down on the stomach, lie on the plank there for me. Can take your shoes off, that's good. Thanks, Mr. Drapey. Is that comfortable for you?
Yeah.
You want to take one of those pillows away? You're not going to direct the rest of you. Okay, so Peter, this one here is going to be warm.
Yep.
Okay. And this one here is going to be cold.
Okay.
And so what I'm going to do is simply change those around. You want to tell me if it's hot or cold?
Yeah.
Okay?
Cold, warm, 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 cold, cold, cold.
Very good, Peter. We're just going to progress on to the ice massage test now. So what I'm going to do is simply just massage your calf with a bit of some ice cube here for 30 seconds. I'm just going to see how your skin responds. Yep. Great, Peter. So Peter's got no redness or no inflammation, so that means he hasn't got a reaction to the ice, so we're right to proceed with the treatment. Just going to give that a bit of a wipe down for that, Peter.
Yep.
Let's put this ice pack on that I prepared before, yeah?
Okay.
And I'm just going to put it over your calf here.
Yep.
Okay. Does that feel like comfortable for you there?
Yep, that's good.
Great, okay. We've got a visual analog scale here, and what we're going to do is initially after 3 minutes, after 10 minutes, get Peter to assess the level of cold on the visual analog scale, from 0 being no cold to 10 being extremely cold. So Peter, initially, what does that level of cold feel like from 0 to 10?
It's around 2.
Around 2?
Yeah.
Awesome. Hold that. I'll be back in 3 minutes, Peter.
Okay.
Okay, good. So Peter, it's been 3 minutes now.
Yep.
How's the level of cold going on your calf?
Yep, it's pretty good.
So last time was a 2, so from 0 to 10, 0 being not very cold, 10 being extremely cold. Where are we at now?
It's around 4.
4. Okay, good. So are you still comfortable? Are you still feeling good?
Yeah.
I just want to check to see if the skin's had any reaction to the ice. So I'm
Okay,
going to take this off for a moment. Okay, there's no redness there, no inflammation, so looking good.
Yep.
So I'll be back in about 7 minutes just to do the final checkup.
Okay. No
Thanks, Peter. Alright, it's been 10 minutes now, Peter.
Yep.
So, final outcome measure. What is it now? Okay, so from 0 to 10, what's your final one?
It's around 8.
8, okay.
Yep.
Alright, so that's the end of the treatment. Hope that feels good.
Yep.
Now, you can just go through to reception, sign out, and we'll see you again next week.
Okay, yeah.
Thanks, Peter.
Thank you.
No problem.
When doing ice treatment, there's some contraindications such as vasospasm, cryoglobulinemia, cold urticaria. Vasospasm refers to the condition in which the blood vessel spasm leads to vasoconstriction. Raynaud phenomenon is an exaggeration of vasomotor responses to cold and emotional stress. More specifically, it is a hyperactivation of the sympathetic system, causing extreme vasoconstriction of the peripheral blood vessels. Cryoglobulinemia is a medical condition in which the blood contains large amounts of cryoglobulins, proteins that become insoluble at reduced temperatures. Cold urticaria is an allergy where hives or large red welts form on the skin after exposure to a cold stimulus. The welts are usually itchy, and often the hands and feet will become itchy and swollen as well.
How you going, folks? This is Jimbo here. Thank you very much for watching the video for starters. I just wanted to let you know, it's a disclaimer, that everything we've been talking about has been backed up in evidence. There's many studies out there that show, the effects of ice and the importance of it. I'm just going to list a few for you now. There's a good one called Soft Tissue Injuries by Lynch and Stanley Green. It came out in 2010 in Common Musculoskeletal Problems. It talks about the importance of ice because it reduces the heat and the pain of the inflammatory process. Another study, a really good one, is Cryotherapy in Sports Medicine. This was written by Swenson, Sword and Carlson in 2007. This study showed that prolonged application at low temperatures can have serious side effects, such as frostbite and nerve injuries. And so all those contraindications we're talking about, they're backed up in studies like this. And the final one we have here is Cryotherapy in Ankle Sprains. This was written way back in 1982, probably before a lot of us were born. It was in the American Journal of Sports Medicine, and it just showed that the early use of cryotherapy is vital. It's nothing to joke about. Ice is important. You've got to make sure that you get have an injury, ice goes on it. It really helps up the process, and there's been many studies to show that. This is a few pieces of evidence. I really encourage you to look up your own. It's really great. Everything in this study has been good. I hope that you really enjoyed this video. Thanks for watching. Jimbo out.